Paraneoplastic limbic encephalitis. Paraneoplastic limbic encephalitis is an autoimmune disorder wherein the body accidentally creates antibodies which destroys the neurons or the good brain cells when the goal was to destroy only cancerous cells. This happens by random chance. This disorder is neurodegenerative, which means the neurons of the brain become permanently damaged or die over time and cannot be replaced. The death of the brain cells leads to a wide variety of symptoms, which causes impairment in the way we think, move, and recall memories. Paraneoplastic means the autoimmune disorder called limbic encephalitis is caused by the immune system's error when responding to a cancerous tumor. Anyone with this disorder also has a cancer or tumor which has caused this disorder called paraneoplastic limbic encephalitis. Although the case study linked to paraneoplastic limbic encephalitis states that the subject is a 29-year-old male recovering from testicular cancer treatment, it doesn't state whether chemotherapy was used as the treatment for this cancer or if a tumor was surgically removed from the testicles. This is significant when considering JM's family history of lung cancer and breast cancer, which are two of the other cancers most prevalent in those with this disorder. The chart states that JM is experiencing shortness of breath, which could indicate lung cancer or a tumor in the lung that is the primary malignancy causing this disorder. If chemotherapy wasn't used to treat this previous cancer, which would have killed all cancer cells, another cancer could be causing this disorder, resulting in the impairment of JM's movement, thinking, and recalling. Cancer in the lung could be causing the symptoms stated in the chart, such as agnosia, which is the inability to recognize and identify objects, persons, and sounds despite functioning senses, apraxia, which is the loss of ability to execute and carry out skilled movement despite having the physical ability and desire to perform them, and paresthesia, which is the abnormal sensations such as tingling in upper and lower extremities, as well as the mood disorder bipolar could also be connected to this disorder. These symptoms and associated disorders, despite JM's range of motion and strength being in normal limits and the Berg's balance scale, TUG, and MMSE results being normal, are due to the damaged and destroyed neurons from the body's immune response to the cancerous tumor. How do B cells intended to kill cancer cells attack healthy cells? How does the immune system get confused by cancer cells? There is a miscommunication between MHC class I receptor on the cancer cell and the T cell. The nucleus of the cancer cell is mutated into RNA and then messenger RNA. This mutated messenger RNA can then be mutated into protein by the ribosomes in the cancer cell. These chains of proteins can be placed on the MHC class I receptor. The MHC class I receptor is loaded with a cancer protein to activate the immune system. Unfortunately, the cancer protein also contains healthy protein that is released into the environment when the CD8 T cell detects the cell and destroys it. The CD8 T cell finds B cells, which are antibody producers, which self-activate to start making antibodies for healthy cells. It is by random chance which immune cells will be activated and which proteins will be displayed on the outside of the T cell, healthy or cancer proteins. Presynaptic neuron and postsynaptic neuron communicate through neurotransmitters. The communication between the neurons happens when neurotransmitters are released from the presynaptic neuron to bind to the receptor of the postsynaptic neurons, and this excites or inhibits that postsynaptic neuron. Neurotransmitters work in groups to excite or inhibit and are released at the same time. If the red antibodies bind to the receptors, the neurotransmitters can't bind and flow away, which cuts the communication between the presynaptic neuron and the postsynaptic neuron, which results in the symptoms of this disorder. When the neurotransmitters bind the receptors on the postsynaptic neuron, this results in excitation and inhibition, which means that when the antibodies occupy these binding sites and there is less transmitters binding and having that communication between the neurons, this causes less excitation and less inhibition. Less excitation leads to poor memory and poor movement, whereas less inhibition leads to seizures. In addition to antibodies disrupting neuron communication, macrophages and macroglia will come along and destroy neurons by recognizing them as pathogens. The macrophages will eat the synapse, consuming part of the synapse before destroying it. So on top of being blocked, the synapse and neuron communication is completely broken. Someone with paraneoplastic limbic encephalitis needs to start treatment ASAP because B cells are making antibodies which are activating immune cells even further. Clinical features of paraneoplastic limbic encephalitis include cognitive dysfunction, change in personality, seizure, irritability, hallucinations, disorientation, limbic paresis, disruption of consciousness, short-term memory loss, behavioral changes, anxiety, depression, and psychosis. Clinical features specific to JM's case are a generalized tonic-clonic seizure, which caused him to go to the emergency room. He also experiences recurrent seizures, progressive short-term memory loss. He has been having difficulty sleeping for 2 months. He has had testicular cancer. He has shortness of breath with exertion, agnosia, paresthesia to hot, cold, deep touched bilateral upper extremities and lower extremities, and ataxia. Activity limitations specific to JM's case includes difficulty problem solving, as his problem solving is affected due to his short-term memory loss. He may also have to hold off on driving for longer due to his symptoms. Participation restrictions specific to JM's case include difficulty sleeping, which may cause him to be less engaging in social situations due to his lack of sleep, as well as inability to participate in strenuous activities like bicycle riding, jogging, weightlifting, and aerobic exercise. That concludes my presentation.